If I uprooted you, took you out of your system, and placed you in a new place, and you were wanting to establish some sort of a musculoskeletal primary care clinic, how would you do it? What would you do first? What things, equipment, what relationships would you go and seek to foster? Talk about that.
Yeah, well, it's a great question, because it's actually what I'm in the middle of right now. And so the executive team that we have with the hospital that I'm at right now, they're very open to this. And it's at this point because I've actually spent time with them, educating them on the qualifications that PTs have. And so it has been, they're very much on board right now. They are a little concerned with there may be a decrease in revenue from imaging, but like we kind of visited about, I think that's just a changing culture that I think if they're actually really serious about decreasing cost, it's got to start doing things to decrease cost. So that's a good group to start with. There's absolutely tons of literature out there with the APTA. They have a site that's actually just for direct access. They have a lot of links to studies that will give you good information to put together just a little package or presentation for the executive staff. And then I think the easy way there's a lot of different ways to do it, but I like to start with the ED, because the majority of the emergency departments will have maybe 10 to 15% of their caseload every day is musculoskeletal. It's things that we could see as physical therapists. So that's, and it would also actually fund a clinic. I mean, it would be the follow-up of the patients you see in the ED is enough to keep actually several physical therapists busy within a clinic. So that could serve as the intake point for those patients coming into the system. The other way is through like employee health, and then you can capture just the employees that are actually within the hospital for musculoskeletal injuries that they may have on a daily basis. It can be lifting injuries, it can be all of the other things. Oftentimes they'll go to the ED, but if you could actually capture them, or they could go to the ED, which would be fine if you can see them there, but have a clinic that's actually ran out of the employee health department, just to see those, ankle sprains, if they twist their back, whatever, those are all appropriate patients to see within that environment. And those are three areas that you could begin with. I mean, I think actually ultimately, like any hospitals, we have there's a senior clinic that we have at the hospital that I work with, which would be actually perfect to put a physical therapist within that clinic itself. So they would have all the musculoskeletal patients, or if one of the providers actually saw a patient that they would like the PT to come in and actually consult, you're right there and you're able to do that. So tons of opportunities, but I think it has to start with the literature. We need just some solid support that says these things have already been looked at. These are the outcomes. We're safe. We can decrease cost, and this is the way to begin to utilize us.
Yeah. From a real pragmatic perspective, would you, versus a patient that came to you referred that had already had a good workup, medically, and then they were referred to you for, say, a case of back pain, versus someone who just came right off the street? I've heard about you. I wanted to come here. It, happened. I've not seen anyone else. Do we take weight? Do we take blood pressure? Do we take heart rate? Do we function in the same way that some of these medical clinics do? Or is that there's no evidence to suggest that that's necessary? What are your thoughts on that?
No, I think that's a great question too. You need all of those bases covered. So you can have a medical tech at the front that would actually do all of that, but all of that information you need. It's all vital information to put together the complete sort of picture of the patient. So I would say absolutely. So I think we need to work just like a DO or like an MD would work. Like if they're seeing a patient with, they're coming in, they twisted their knee or whatever, they get all of those as standard, tests, and we should be doing the same.
Mm-hmm. Yeah. Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.